A lot has changed since the September 11th attacks, especially at Ground Zero in New York. In this newly released time-lapse video from 2004 to now, you can see the new Tower 1 skyscraper forming in the footprint of the Twin Towers. 3 other skyscrapers will complete the 16-acre complex in Lower Manhattan. And that's not the only thing that's changed since 9/11. Our travel, our government, our trust in people have all evolved in the last 10 years.
But the events also provided a wake-up call when it comes to preparing for the future. 2 News anchor Erin Christy takes a look at how health departments have changed since 9/11 in tonight's segment 2.
September 11th, 2001. Thousands died in the attacks on the World Trade Center Twin Towers, the Pentagon, and Flight 93 that crashed in Pennsylvania. Since those attacks, police and fire departments have changed and improved the way they respond to emergencies, and so have public health departments. Across Green Country, the Oklahoma State Department of Health says response is faster than ever, from being able to deliver 1,500 meningitis vaccines within hours to the Ulaga-Talala schools in 2010 after a meningitis outbreak at the school district, to getting mobile health units to tornado disaster sites upon receiving information about the storm. 9/11 served as a huge wake-up call to response teams across the nation, including Oklahoma. But here in Oklahoma, the real wake-up call started with the Oklahoma City bombing. Carrie Sons with the Tulsa Health Department says they learned a huge lesson with the passing of a nurse trying to help during the 1995 bombing in Oklahoma City. The nurse was trained medically, but not for a disaster situation. She was hit in the head inside that building and died.
She needed to be trained on situational awareness. Don't just rush into a burning building. We've got to take care of ourselves first, because if we don't take care of ourselves, we become victims.
After 9/11, THD established the Oklahoma Medical Reserve Corps, a trained and credentialed group of volunteers dispatched from this emergency call center to help when medical staff is overwhelmed during a disaster situation.
During 9/11, we found out that tragedy can hit anywhere, and people here in the United States want to help. And so we're going to help no matter what. So we just want to make sure that people are pre-trained and pre-identified.
Today, the department uses an event as small as a flu shot clinic to train and prepare staff for a large-scale disaster.
The seasonal flu was a great way to practice our plans.
By setting up mobile sites and sending teams out to various areas for vaccinations across the city, it allows the volunteers and staff to get an idea for a real disaster.
We have numerous plans of what if this happened, what if that happened, how we would respond.
State and local officials know preventing an attack isn't possible, but say the last 10 years have made them more vigilant and prepared than ever. Erin Christy, 2 News works for you.